Finland is facing a growing crisis with the synthetic drug alpha PVP, commonly known as Peukku. This potent stimulant is overwhelming the healthcare system and driving a significant rise in crime. What makes this problem unique is its rapid spread, particularly in southern and western Finland, and its severe, often violent, side effects that are straining hospitals, psychiatric wards, and law enforcement. The crisis isn't just a local issue, it's a national emergency that is changing the dynamics of the country's drug market and public safety. The Finnish Institute for Health and Welfare, THL, uses wastewater studies to track drug use across the country, providing an unprecedented view of the problem's scale. The latest data reveals a steep increase in Peukku use, especially in the Helsinki metropolitan area and Tampere. Unlike traditional drugs, Peukku's presence in wastewater is consistently high throughout the week, indicating continuous and problematic use. The studies confirm that Peukku has become the most common new psychoactive substance in Finland, with usage concentrated in the south and west. The THL's research also shows that while Peukku use has surged, so has the use of other stimulants like amphetamine and cocaine, with both hitting record levels in 2024. These findings not only highlight a shift in drug consumption habits, but also allow for a more accurate estimation of the drug market's value, which has increased significantly over the last decade. Peukku is causing severe physical and psychological damage. Patients are arriving at hospitals with extreme symptoms, including psychosis, cardiovascular problems, and violent behavior. Dr. Tuuli Kormano, a chief addiction specialist, notes that the drug creates an intense dependency, with withdrawal symptoms so severe that many users relapse immediately. Other common side effects include brain hemorrhages, seizures, and heart attacks. The psychological toll is also alarming. Experts report a sharp increase in symptoms like paranoia, panic attacks, and hallucinations. A significant number of users who experience stimulant-induced psychosis may go on to develop chronic psychiatric conditions, including schizophrenia. Dr. Margarita Hekainen, a senior forensic specialist, connects the drug's use to spikes in assault cases, suicides, and homicide investigations. The surge in Peukku use has led to a significant increase in police activity and crime rates. In Helsinki, police seizures of alpha PVP rose by over 700% in the first half of 2025 compared to the previous year. Law enforcement reports that calls to address disturbances related to substance use have doubled, leading to intensified patrols in hotspots like Kurvi, Itäkeskus, and Konchola. The high cost of the drug, with some users spending up to Euros 6,000 a month, is fueling a wave of property crime, fraud, and robbery. The Helsinki Police Department confirms that theft offenses have seen a 54% increase, and these incidents are often more aggressive than in the past. Chief Inspector Kimmo Seinio indicates that foreign organized crime groups, particularly from the Baltic countries, are responsible for trafficking the substance into Finland. One of the most alarming aspects of this crisis is the discovery of home laboratories used to produce Peukku. Police have dismantled several production and distribution networks, finding these drug factories in ordinary apartment buildings. These labs pose a grave danger to the surrounding community. According to Detective Chief Inspector Jussi Gustafsson, the chemicals used to produce Peukku are highly volatile, with a risk of explosion and corrosive properties that could harm not only the people inside but also their neighbors. A strong, pungent smell emanating from an apartment could be a sign of such a dangerous operation. Police are urging citizens to report any suspicious activity to ensure public safety. The growing Peukku crisis is a complex issue with no easy answers. While the healthcare system is overwhelmed and law enforcement is stepping up its efforts, there are limited specialized treatment options for stimulant addiction. Experts are calling for urgent investment in substance abuse treatment to address this national emergency. This crisis underscores the need for a multifaceted approach, combining police action with enhanced healthcare services and public awareness campaigns.